This year, more than 287,000 women in the U.S. will be diagnosed with invasive breast cancer, and 43,000 will die from the disease. While the numbers are alarming, there are ways to reduce your chances of getting the disease, as well as ever-increasing treatment options. Here to tell us more is medical oncologist Dr. Stroh from Mercy's Hall-Perrine Cancer Center. Thanks for joining us, Dr. Stroh.
Thanks for having me.
And so tell us, we hear a lot about breast cancer, especially during October. Are we making positive strides to reduce the prevalence of the disease?
We are. We're actually able to detect cancer earlier with better imaging processes, and we're also doing high-risk models to identify women who are at higher risk for getting breast cancer so we can watch them closer so they don't develop it.
It's so important for that early detection. And so let's talk about prevention. Does that still start with self-breast exams?
Yes, it does. So prevention is huge. I always tell women to know their breasts, to know any changes, and that to never ever be told, hey, there's nothing wrong, you're fine. You're never too young to get breast cancer, so any lump or bump, please seek out medical attention.
And trust yourself when you feel like something could be wrong. What are the options for breast cancer screening?
So we have tons of options. We have our standard mammogram, which is still standard of care, which has improved lives in overall survival. But we also have MRI screenings as well as automatic breast ultrasounds, which helps early detection, especially in women with dense breasts.
Yeah, you hear a lot about the mammograms, but there's way more than that.
Yes.
And where are we at with treatment options? Are we making progress?
We really have. In the last 15 years since I've been practicing, things have changed tremendously. We're now using immune therapy for some of our more aggressive cancers and increasing our cure rate with oral medications. There's all different things that are happening and exciting in the breast cancer community.
Is there something you wish women knew about breast cancer? Any misconceptions or anything like that?
No, I think, again, it's really knowing your body and never being told that you're too young to get breast cancer, because I do have a lot of young women with breast cancers who've been told for 6 months or more that it can't be, they're too young. So please get checked.
And in that 6-month time, can that make an impact?
It can advance the stage and decrease the risk of, or increase the risk of their cancer coming back.
And as far as self-checks, what are some things that you wish women knew about doing that?
Well, I think don't do it too often, because sometimes you can get obsessed over lumps and bumps, but usually once a month in your shower, and just knowing and also feeling in the armpit or the axilla to look for lumps and bumps.
All right, some great advice to think about. Dr. Stroh, thank you so much
for having me.
And stay with TV9, we'll be right back.